Hello, hi, Assalamualaikum, and every good evening to everyone. My name is YUSMAWANY binti Abdul Halim. My metric number is 2020320999.
Assalamualaikum warahmatullah. My name is HASNIZAWATI binti Hashim. My metric number is 2020977309.
Hi, Assalamualaikum. My name is HIRDA Juwita binti Arjuna and my metric number is 2020929757.
We are from Faculty of Business Management. Our lecturer name is Associate Professor Zaidi bin Muhammad Aminuddin. We are here to presenting our group assignment for the title Public Policies, Inflation, Unemployment in Indonesia due to COVID-19.
Introduction. COVID-19 disease 2019, or we call COVID-19, is a disease caused by a new type of coronavirus that was first detected in Wuhan City, China in December 2019. It spread throughout the world due to human-to-human transmission of the virus. World Health Organization (WHO) declared COVID-19 as a pandemic on March 9, 2020. In Indonesia, the first positive case of the COVID-19 detected on March 2, 2020, and it is continued to spread. On July 31, 2020, the number of positive patients infected was 108,376 patients, died 5,131 people, and recovered 65,907 people. The government has made various efforts of Indonesia to prevent the spread of this disease in Indonesia, among others, the strict supervision of the routes of entry to Indonesia from other countries through airports, ports, and land border posts. Also, the primary protocol for handling cases of the spread of COVID-19 was published. The government has made various efforts to prevent the spread of COVID-19. However, the spread had a provision in peoples. The government conducts socialization so that people are disciplined in using masks, washing their hands with soap and running water, avoiding crowd, maintaining health, not traveling anywhere, leaving their house as needed, and the rest staying at home. Until end of May, the task force of the acceleration of handling COVID-19 reported that 29 areas had implemented the PSBB, consisting of 4 provinces and 25 agencies of cities.
Number 2, public policies. In mid-February, Indonesia Health Ministry Terawan Agus Putranto pointed to divine intervention when explaining that no case of COVID-19 has been identified in Indonesia. Despite his advice for continued prayer, the first case was confirmed on 1 March. During the following weeks, many more cases were confirmed. As of 30 March, the total stood at 1285 and the number of related deaths increased to 114. From an international perspective, the numbers are still low, especially related to Indonesia's population. But it's now understood that this is due to under-testing. Indonesia has one of the lowest rates of COVID-19 testing, and it is concentrated in Greater Jakarta, where the country's best medical facilities are. Indonesian government needs to play an important role beyond testing, containment, treatment, and economic stimulus. It needs to build public confidence and trust in leadership. It will take effort, as Indonesians are generally not imbued with a strong sense of trust in politicians and the public service. Government and public agencies must be frank and clear about what they know, how they assess the situation, and communicate their intentions. Clear communication with regional governments will also be crucial in defining, coordinating, and implementing remedial efforts.
Problems and method to overcome inflation and employment. According to Bank Indonesia, www.bi.go.id, the inflation rate in Indonesia was 3.02% and was considered mild inflation rate. However, in 1997, during the monetary crisis, Indonesia experienced a heavy inflation rate that reached 11.05% and later increased to 77.63%, and in 1998, based on BPS Indonesian statistic. In the fiscal policy, one of the policies implemented by the government was arranging for the state budget APBN of the target of the State Budget Plan 2017 was reducing the unemployment, assuming the Indonesian government simultaneously would like to have a controlled inflation, lower tendency, and reduce the unemployment. Of course, this was not analogous to the theory presented by Phillips in the Phillips curve that stated there was a trade-off between inflation and employment. Therefore, proof was needed on the presence of Phillips curve in Indonesia for Indonesian government policy effectively in pressing the inflation and reducing the unemployment.
Inflation. Inflation is a tendency of prices to rise in general and continuously. However, the price rise only for one or two products. It could not be called as inflation, except if the price rise spread or resulting the rise of prices of most of the other products. The product price rise does not have to be at the same percentage. Inflation is a continuous rise of price, and the price rise occurred at the entire product and service group. It could be possible that the price did not rise simultaneously. However, it is positive that inflation is a continuous rise of product price in a certain period. A price rise that occurred only once, even a big percentage, is not an inflation. There are some macroeconomy indicators to measure the inflation flow within a certain period. Among others are Consumer Price Index, Wholesale Price Index, Gross National Product Deflator or Deflator GNP.
Unemployment. Unemployment is a criteria implemented to one who don't have any occupation, but within the last 4 weeks is activity looking for a job. According to the statistic from BPS in the employment indicator, employment is one who don't have an occupation but is looking for a job or preparing for a new business, or one who doesn't not look for a job because he has already a job but has not started working as yet. Unemployment is a situation where one who belongs to working force would like to have a job but they have not got to the job yet. Unemployment may take place because of unbalanced working force market. This presents that number of working force is exceed the required number of working force. One who doesn't not work but not activity analysis on unemployment and inflation in Indonesia. Looking for a job doesn't not consider as unemployment. The main factor that causes employment is lack of aggregate spending.
The conclusion is the analysis conducted above helps prove the hypothesis of this study. The Indonesian government is not fully ready to face the COVID-19 pandemic. Determination of the status of public health emergencies is usually a strong message that the public health paradigm and approach are the commanders leading the war against the pandemic. This is explained by the fact that this pandemic reflects the public health situation. Comprehensive and integrative handling should be emphasized not only in health services but in other important aspects of behavior, environment, social, economic, political, cultural, and genetic factors. Regardless evidence and the theory supported, we are aware of the limitation of our study as analytical work. First, the idea was built at the beginning of the notification from WHO about a potential outbreak of a new disease. We expected that the government took as fast response through strategic decisions and technical instructions to prevent the entry of the new disease into Indonesia. Second, we conducted this study's hypothesis after seeing the government who took steps to deal with the new disease 2 months after the notification. This study could not capture the possibility of significance, the change and response from the government, so the approval of the hypothesis will only be relevant for the time being. Then, this review was written in the first 4 months of handling the pandemic in Indonesia with the many social restriction regulation. As a result, we encountered limited data, other source information and methods as the triangulation mechanism.
That's our presentation. Thank you for your time and for your attention. Assalamualaikum.